Hello and welcome back to the Armor Men's Health Show. I'm Dr. Mystery, your host, board-certified urologist, a self-proclaimed men's health specialist, joined by my co-host, Donna Lee.
Hey, everybody. Welcome back to the show.
Many of our listeners like Donna more.
That's right, because I am more personable and friendly.
That's right. And you do answer the phone. If you'd like a free T-shirt or you'd like to make sure that your question gets on air or you just want to chit-chat with a real chatty person, Donna, how do people get a hold of you?
That's me. You can call us at 512-238-0762, and my extension is 220, or just ask for me. I do have 1 zillion free T-shirts to give away. Our website is armormenshealth.com, and you can submit your question at the top right where it says submit a question here, and we'll answer them anonymously on this show. Again, armormenshealth.com, and we are in Round Rock, North Austin, South Austin, and Dripping Springs.
So, we would love to see you as a patient, too. We have lots of availability, and we have so many providers. We have probably, 11 or 12?
We have 112 providers
urologic
now.
providers in 4 offices. So we have room for you. We take, all the insurances, and we take care of many, or all of the urologic conditions that you need to be seen for.
That's right.
And men's wellness. I mean, when it comes to testosterone, erectile dysfunction, weight loss, these are things that we pride ourselves on having excellent practitioners, and we are joined by one of those today.
That's right, our new guy.
Happy to be here.
Welcome, Stephen.
Stephen Macenas, physician assistant. Stephen, thank you so much for, again, joining us today.
Absolutely.
In the last segment, we talked a little bit about men's wellness expectations when it comes to feeling better and what's important. But one area that is unique to our practice, I think, is the incorporation of sleep medicine within urology. And I've talked about it on the radio, and it's really a big part of our holistic approach to men's wellness. And I thought maybe you could go through a little bit about what you've learned and what you bring into the importance of sleeping well and feeling well.
Absolutely. And so before I came to NAU, a lot of my sleep referrals were sent out, but now that they're in-house, really, I wanted to learn more about them. And so I put together some numbers researching the symptoms that come to urology and how they're related to sleep. One of them, very interestingly enough, is kidney stones. About 80% of your waste products is given out through respiration. And so if you're not breathing at night, you're just accumulating garbage, right? And so your kidneys have to step up to the plate, and that will change your urine composition, creating a stone-friendly environment. And so there's some interesting correlations between sleep apnea and stones. And so one of our protocols with dealing with a stone acutely, as well as into the future to prevent stones, is actually to get a sleep study performed.
Now, we're so deep into this. We understand that sleep apnea, where you're kind of choking for most of your night, is probably not good for you.
Some people enjoy that.
But, oh boy.
We've discussed that before, you know.
We have a sex therapist, by the way.
Fetish.com. So,
OnlyFans.
So when do you, but I think many listeners and most of my patients do not understand what sleep apnea is, and they're totally befuddled when I ask them about sleep when they come into my office. So they're like, Dr. Mystery, I'm tired. I'm gaining weight. My testosterone's low. And they're like, well, why are you asking me about sleep? I'm like, well, it is 1/3 of your day. Don't you think?
Absolutely. Invest in your shoes, invest in your bed, right?
And so maybe you could tell us, how do you describe what sleep apnea is, what causes it, and, just kind of colloquially, how you interact with patients?
Right. So it's measured through a nasal guard, a chest strap, and a pulse oximeter on your finger. And through this, we can determine how many times per hour you stop sleeping. And
stop breathing.
It's comfortable.
Yes.
It's not constricting. It's actually pretty comfortable.
Yeah, a lot of people think of the Bane mask from Batman, right? It is not that.
Yeah,
much smaller. And so we look at these as a measurement tool per hour. And so you don't have to be overweight. You don't have to be daytime fatigue, and you don't have to snore to have sleep apnea. And these are the 3 misconceptions I'm trying to spread the most, because the amount of times I get a nice, young, healthy, fit guy coming in and he stops breathing 15 times an hour after we get the sleep study done is insane. And so I'm a firm believer that this should be part of primary care medicine. Around age 30, everybody gets a sleep study. Why not, right? Because you're exactly right. It's one of the largest parts of your day. It's the most important thing you can do as a human being is get that reset button. And so if you do not get a lot of volume of sleep, might as well make it quality.
And so what we're testing in sleep apnea is how well you're oxygenating throughout the night. And like you said, it's part of our reset and regeneration. So if you're not oxygenating well, then you are going to have a tough time healing your tissues and making things better. And you mentioned when it comes to kidney stones that we expel a lot of our waste products through our respiration, because the lungs are a wonderful system of all the blood in our body goes through our lungs. So it's a great opportunity for our body to get rid of certain waste products. And if you don't sleep well, if you don't oxygenate well, if you don't exchange well, then you're going to be at bigger risk for accumulation of these bad metabolites. And you've already picked up on one thing, which is an increased risk for kidney stones. Now, I also feel like it leads to obesity and weight gain. Why do you think that is?
It's a vicious spiral. Just the accumulation of inflammatory markers that you're not able to get rid of course, is going to affect every part of your body. The biggest correlation, right, and I want you to remember this one, is early cardiac death in sleep apnea at 60, right? So from a urology standpoint, of course, kidney stones and erectile dysfunction and low T, right? But obesity is a big one as well. If you're not sleeping and you're in constant fight or flight the next day as your body tries to stay awake, because you did not sleep, you're dumping cortisol and other stress hormones that are just going to be giving you the jitters, anxiety feeling throughout the day, as well as just the overall sense of fatigue. And then you think you're going to go to the gym if you feel like absolute garbage all day. I mean, your poor food choices, your brain wants immediate energy now because it's deficient all the time. And so you're going to be relying on those quick fixes, and sugary foods are going to be the first thing you think of most of the time.
And addressing sleep apnea, I mean, I think that people are very concerned that they're going to have to walk out with a CPAP machine and walk around with, a hose and things like that. So I think, I come across a lot of patients who are resistant to getting tested because they don't want a CPAP machine. What would you say to those people, just kind of that are resistant to even seeking treatment?
Well, there is always new technology in the sleep world as well, because it's something that is, I feel like, being studied a lot more now. We have oral appliances that are similar to a retainer that can push the lower jaw forward, and that might be the only fix you need. And so through the sleep team, they will assess not only your breathing in terms of oxygenation, but how you breathe and your facial structure to determine if maybe an oral appliance would be better, which is something that a lot of people can tolerate a lot more than the Bane mask. So it's not always immediately the big machine.
So we have a lot of wives that listen to the show, and they also send a lot of complaints. But a lot of wives that listen to the show. And so I think the wife knows when the husband isn't breathing. I hear it all the time.
I love when the partner joins, because a lot of people don't know that they snore. So I turn to the partner and I say, what do you think? Are you getting your sleep affected by their poor sleep? I mean,
my favorite is the husband that goes, how can you tell if I snore? How can you hear me over your snoring?
Right. And so maybe both of you should come get seen over at NAU.
And so when I see that, when I see like a heavy-set man with a big red face that sits in the chair, and I know that he has severe sleep apnea, you can tell.
Right.
And his wife's like, yeah, he stops breathing, like, I've got to shake him up. I'm like, are you trying to make sure that he dies early? Like, because how come you haven't brought him to the doctor
She
sooner?
just got the will in order.
Like, aren't you? Yeah, she's probably spending more time on lawyers than trying to get your butt to the doctor's office.
Amazing.
So if you're out there and your husband or your wife is, visibly not breathing throughout the night, I would probably get checked out. I mean, this is not normal.
Absolutely. Yeah.
And so you mentioned that we have that program in-house. So somebody comes in and, people aren't going to come to see a urologist for sleep apnea necessarily, but certainly we're going to be including that as part of our, workup when it comes to low testosterone, weight gain, and other things that we deal with. So you mentioned it briefly. What can they expect when they go home? Like, because they're going to leave our office with something. What are they going to leave with?
Yeah, it's a little kit that's going to include the 3 pieces: the pulse ox that goes on the finger. You maybe are familiar with that. A chest strap that actually measures your inspiration and expiration, how big you're breathing, and then a nasal cannula. And so these three are put together through some fancy software to calculate the numbers that we need to make sure that you get fixed up.
And you wear it for a night or two. You bring it back to the office. We have a board-certified sleep medicine pulmonologist that reads the sleep study. And then you get advice based upon what you need. And sometimes that advice is weight loss. Sometimes that advice is an oral appliance. Sometimes if it's really severe, we give you other pieces of advice. And honestly, if you come in and you're like 55 and have bad sleep apnea, we may encourage a more thorough cardiac evaluation as well.
Mm-hmm.
Absolutely.
So, Stephen, thank you so much for joining us. You're really a testament to the kind of program that we're trying to put together at NAU Urology Specialists. Donna, how do these lucky listeners become patients of ours and reach us?
You get to call and make an appointment with Stephen or Dr. Mystery at 512-238-0762 and visit our website wherever I keep fucking that up. You can listen to our podcast wherever you listen to free podcasts. Thank you so much.